Now, I'm really happy to be here with Jennifer Daddow. Jennifer has worked in education services at Carers Vic for 12 years. So she's been with them a long time, facilitating workshop for carers and service providers. She's a skilled educator, facilitator and public speaking. Jennifer has worked extensively with community adults and with a range of diverse groups in community welfare and health sectors, and she has a master's degree in health, is a qualified trainer and assessor, and certainly a very, very passionate person about carers. And we're going to start to talk to Jennifer a little bit about, I'm going to start with, what is a carer and how do we define carers?
That's an excellent question, Jodie. It's a good place to start. And I'm thinking, as I was sitting listening to the other speakers, what a great thing to move from Dr. Kalanchik and thinking about the clinical picture of a person living with MS. And what occurred to me in answer to your question, we're talking about carers, and carers are family members or friends who are also living with MS, because an illness affects one person's body, but it ripples out to affect those around them. So if you like, the official definition for carer, which is in legislation and bureaucracy and research, is a carer is a family member or friend who is providing support to someone with a chronic illness, obviously in this case MS, but I want to mention the other categories: chronic illness, a disability, mental health, or who is frail aged. And the reason that I mention those other categories is, and a shout out to all those carers out there who are participating today, is that what we know about the caring role is that many carers are juggling multiple roles. So you might have someone listening today whose partner has MS, but they might also be supporting an adult child with a mental health illness, or if they're an older person, they may also have a grandchild with a disability that they're helping to support. So I'd like to broaden this conversation and see the ripple effect that someone living with MS has, and consider the family members and the friends.
We sort of think of carers as a really kind of, I know when I go to carers, I imagine someone is even providing lots of support for people with, high level disability, or my providing care for my old mum and dad by, bringing them meals and stuff. But I think right from the time that someone's diagnosed with MS, there's someone around or people around who fall into that category. Do you think sometimes the definition of carers means that people sort of don't identify themselves as carers, and then, what does that mean?
Absolutely, Jodie. So what we know about the word carer is it's a little bit clumsy, a little bit uncomfortable, because people naturally define themselves by their relationship. I'm not a carer, I'm his or her partner, or his or her mother, or his or her friend. And so people don't identify with the term. And that's absolutely fine, as long as those in that caring or supporting role understand those extra roles and responsibilities that they're taking on. It's just a term that helps define a particular unpaid job that people are doing. And so it's a term that's used bureaucratically and in research and so on. And I think when we use the word carer, Jodie, I also think that what it does, it gives opportunity to broaden even more away from the traditional sort of partners, married role that these conversations can sometimes get into. It can recognise carers in the LGBTIQ community. It recognises carers within, various CALD communities who might not recognise their caring role because cross-culturally that concept may be foreign to them. And so by using the term carer and introducing people to it via the word perhaps support role, we can help people understand what it is that they're doing and therefore reach out for the supports that they need.
It's certainly people living with MS. Most of us have a huge support crew for all different lives. As a parent, I've got a big support crew, and so, but carers is a little bit more than that. So how do you sort of capture that when you're thinking about Carers Vic services and service delivery? How do you sort of capture that?
Okay, so a carer is defined by the the role that they undertake. So I might be your carer, but not living in the same house as you, Jodie. If you've got MS, I might be living in another suburb because my life is based there. And so there's not just living under the one roof who's a carer. I might be supporting somebody who is in residential care, but I'm still their carer in that I'm there lots of days, I'm managing their finances, I'm providing emotional support. On the other hand, I may live in the same household as you, but I'm not actually doing anything really to support you in your day-to-day living. And, you know, sometimes the invisibility of carers, for example, let me give you an example of invisibility. We know as a cohort that young carers have only been studied since, I think, about the 1990s. And it's a little bit like the iceberg, you know, with just a little bit showing on the top and the rest underneath. So young carers as a cohort, and some of you may be listening today, or some of you are parents of those who really we would classify as young carers. They're involved in support in that informal way, but they're kind of invisible to themselves and invisible to those around them because they don't recognise what it is that they're doing to help that person with the illness cope in the everyday. How do we get that message across? Bit by bit, person to person, via support groups, via clinical settings where therefore the carer becomes aware that they are equally important as a person with the illness.
I know Carers Vic have done a huge amount of research to back the strategy that they've got to support carers, and that's sort of become a real hallmark, I think, across Australia, that the Carers Vic strategy and the real depth of research that they went to talk to people in that role. What are some of the things that emerged from that research that have informed the strategy, but also what you learnt about carers? Can you tell me some of those things?
Yes, I really would like to, because the research replicates research from around the world where the caring role is researched and understood. So our research replicates things like the impact of the caring role on the carer. So the kinds of themes that emerge in that research are the isolation that carers often feel. And I was interested to hear your CEO, when he kicked off the day today, talked about the 12% more sense of isolation that people living with MS experience. That also applies to the carer. And so isolation is a big one for family carers. They may not talk about their experience to others. They may feel disloyal if they do so, or they're not sure who to turn to about that. Another theme which emerges in research is the impact on health and well-being for the carer. Immense. And it's because of this impact on health and well-being, which arises because carers don't recognise their own needs or are so busy smoothing out the bumps for those they're supporting, they ignore their own health and well-being. The impact of that is that carers are actually a vulnerable group in our community. And as a result of that, in 2010, the federal government passed legislation called the Carer Recognition Act, which recognises family carers, and all the states have followed suit. So in Victoria it was 2012 that act was passed. That act was passed as a recognition of the vulnerability of carers. They're vulnerable because of the isolation, of the impact of their health and well-being, and of other horrible little things that happen to carers that mean they don't reach out to have a break or have supports for them. Guilt is a terrible thing for carers. They experience guilt that they want a break, guilt that they didn't get the disease, guilt that they sometimes just want to walk away and forget it all, guilt that they feel they're not doing a good enough job, you know, when we know that most carers are working harder than anybody to do the right thing. So those are the impacts that affect carers and that research consistently shows.
I'm sure that there are a lot of people who really resonated with that sense of guilt, and most people come from a good heart and a desire to really to serve and to support people, but I've also seen sometimes that it's so hard that people actually withdraw, and that's where destructive relationships can start to happen, and particularly in the early stages of MS as well, or not particularly, but as well as. How important do you think it is about getting that right at the start? Because the minute someone's diagnosed, really, they become, to a degree, a carer. They have a different role in life. They have all that changed. And as I said, I've reflected to see that if you don't know how to get that part right, it can be really destructive. So what do you think about that? And how can you sort of help in that space?
I've got two responses to that question that you're asking, Jodie. The first is, by implication, you're, well, without really knowing it, you're giving me the opportunity to say that not all carers take on that role out of that sense of family love or partner love or friendship. That some carers, actually about 30% of carers, take on that role out of pure duty. There might already be in a troubled relationship, or they've stepped back into a relationship that has been troubled in the past in order to take on that caring role. And I think that takes a particular kind of courage. But how do we make sure that the carer gets those messages for self-care and self-preservation and the value of their own life from the beginning of that journey? Well, that would be nice. I think it happens by degrees. I think it's rare that carers get that message at the very beginning. I think somewhere down the track, carers often get that. It depends on the cohort that you are looking at. And so what helps carers is getting in a group, and it was great to hear your peer support group chap talk, whose name I've forgotten, Greg. I apologise. Greg, yeah. Talk about the importance of peer groups. He was talking about for those with the MS diagnosis, and I would say support groups for the carer are really important for all the same reasons. So getting into that kind of group helps carers realise the legitimacy of their own needs and helps them find out how to get some of those needs met. Hopefully when we go out across the state, as we do in Carers Victoria, conducting education sessions with carers, they pick up on some of those clues. So we can't change what's happened in the past up to that point in a carer's life, but we hope by planting the seed we can have a brighter future for them as they develop habits of self-care and appreciating their own value.
And how's that? What sort of things are Carers Vic doing in terms of when you're talking about going out for education, and what sort of things are people doing in terms of and how are people supporting people's well-beings? Give me some ideas about what you're doing there in that space.
Okay, well I'm going to go big picture first.
Great.
Because those listening to this presentation or watching this presentation will be living in various parts of the state and probably interstate. So let me point out how the system works and then give you some examples. Would that be helpful?
Perfect.
So in 2020, in the middle of a thing I like to call COVID, the Carer Gateway was launched, which is the federal program. It was a centralised place where carers go. You know how NDIS became the sort of centralised place for disability funding, my aged care, and so the carer supports, which was scattered all over Australia, became centralised, the Carer Gateway, and I'll give that number out shortly for those who would like it, or I'm sure it can be put on the website at the end of this. So what happens is that across Australia, carers register with the Carer Gateway. And for those who are computer savvy, have a little look on the website. There's some little helpful online courses you can do about your own health and wellbeing and so forth. Then, from that initial contact, carers are referred to their local carer support services. Depending where they live, within Australia, those local hands-on support services will be handled by a different organisation. So that's as much detail as carers need to go. One number referred to their local supports. So the kinds of things that they can get from their local supports are things like flexible respite. Flexible respite is for the carer. Flexible means maybe someone comes in to sit with the person while the carer goes out and has their hair done or has a coffee or goes to a movie, things that are very important for nurturing their own soul. Maybe the carer comes in to take out the person with the particular illness, and remember those 4 categories that I mentioned. In this case, MS, but it might be someone with, frail and aged needs or a disability or mental health condition. so that the carer can just be home and relax and binge on Netflix or, you know, walk the dog or whatever it is that brings them joy and sustenance into their own spirit. Or it could be money that is spent on, for the carer, a gym membership, which wasn't so big during COVID but is creeping back in now, or movie tickets for the whole family. So flexible respite is all about the carer, and it's important for those listening to know that there is federal money and there is state money for the carer that is quite separate to whatever package their person is on.
So it's independent of NDIS?
Completely independent. So whatever your person, and I use that generally as the person with MS in this case, they might be under NDIS funding or My Aged Care. Whatever is happening for them is separate to what the carer is eligible for. How did the carer find that out? They ring the carer gateway.
Yeah. And is that for, I talked about, you know, even before, there's lots of hidden disabilities in MS, lots of people experience, Tom has talked about some of them, fatigue and brain fog and all those sorts of things that can really can add sort of a layer in itself to people providing care. So, but not necessarily, you know, might fall outside of NDIS funding. Are those supports available for people?
Yes.
Regardless?
Yes. Mm-hmm. Yes, they are. Right. So the eligibility criteria are listed on the website for the Carer Gateway. It's very broad. The person you're supporting doesn't even have to have a diagnosis. It's always based on the things that you do. I don't mean there's obviously something wrong, but they mightn't have had the definitive diagnosis there. It's based on what the carer does to give support. And our services are available. If someone self-declares, you know, I'm a carer, we take them at face value. There's counselling available. There's those hands-on respite available. Yeah.
You also mentioned, just in passing, joy and sustenance, and really, I really picked up on those words because I think it's hard being a carer and finding joy and sustenance, and how important has that been in part of what you're doing at Carers Vic?
Do you know, it's not part of our tagline. Our old tagline used to be anyone, anytime can be a carer, which is true. Diseases can happen slowly over time, or an accident can happen suddenly. You know, anything can throw us into that caring role. Maybe our tagline should be providing joy and sustenance, because, and I've worked with carers, it's 13 years now actually, Jodie, I must update that, and I've worked with carers across the state, and the continual theme I get is that carers feel they don't have a right to their own joy and sustenance. Out of the goodness of their heart or out of a sense of duty, whatever the motivation is, they believe that they have to abandon all of that. And that is the surefire way for carers to go under and for them then to become this vulnerable group that I mentioned. So joy and sustenance is vital for all of us. We would encourage that journey for those who are living clinically with the disease MS, and I would see it as absolutely vital for the people around them who are also living with MS. Otherwise, what's the point?
Mm. And as you've mentioned a couple of times, there's that danger of becoming a really vulnerable group of people who really get to a stage of what's, you know, I've heard the term carers burnout before. Do you think is there practical ways or words of wisdom that you can help people? How do you identify when and where that's going to happen? And then what do you do about it?
Well, I wish there were a magic bullet to do something about it. I think once carers get a whiff of this idea that they're not alone and they begin to reach out to others in a similar situation, so I'm not sure if your peer groups here are for family and friends, then they begin to open up that opportunity for themselves to realise their life is of equal value and they have the right to do things that sustain them, to pursue hobbies they once had, or to socialise, or to pursue work if paid work, or to study. And respite should be about making that possible. It also means that they need to share the care probably with other professionals. So a big stumbling block for many carers is they feel they must do everything. And as they are introduced to carer education, we hope we push those boundaries out a little bit and let the carer just bit by bit let others into the life to help with that, that support that's needed in that household.
Yeah, I think we've come back a lot this morning to that concept of, that there's connections and connectedness are really broad, and that lots of people have a role to play. I want to come back to Hawthorne's hashtag play your role, but it's so true, isn't it? Everyone has a role in supporting people in that connection and in that focus, and for people with MS, but also for carers as well too, to be able to recognise that you don't have to do everything, and that other people are part of that as well too, but also that you can have a big connection group for yourself. And you talked about that value of reaching out initially, making that. It takes so much courage to say, hey, I'm really struggling here, and that's such a courageous point, but often a door to being able to do that. And another door, I think, is also coming back again to that recognition that you are a carer, that you are able to reach out, and that it's okay to do that. You don't have to be the everything to everybody, and so incredibly valuable. What about some of the research that's going on? I know that there's a lot of that going on in research. Are you part of that, and what are you learning about that?
Well, the research, I would say, is collaborative research. Mm-hmm. So Carers Vic doesn't hold that what's the word I'm after, Jodie, isn't the only person involved in research. Let me give you a couple of examples. The Institute of Family Studies a few years ago under Edwards did a study of carers and found that carers as a cohort, as a group, were 40% more likely to experience their own physical and mental health issues than the general public because of their caring role. Let me be clear, I'm not saying if you are a carer you'll get sick. I'm not saying cause and effect. What I'm saying is that carers who don't recognise their own needs are in a vulnerable position. So that's a big piece of research. Another big piece of research, which was quite a landmark, was for Australian Unity and Deakin University have over a number of years done research amongst large groups in our society in Australia. People who are unemployed, people living with a disability, carers. And carers came in considerably lower than all of those groups in terms of their self-reported health and wellbeing. Then the carer associations around Australia do research. So, for example, during COVID, Carers New South Wales did some research on the effect of COVID. And they didn't use this word, but my word is, I think what their research found is that COVID was an intensifier of all those yucky things, of the isolation and the lack of services and the closing in, which carers can experience anyway, but COVID made it worse.
I love that term because
you can have that word, Jodie.
I was using amplifier, but I like intensifier. But, there were so many aspects of that. But one of the things that we really heard from people calling into our line at MS Connect as well was this concept of that. One person put it beautifully actually when I was chatting to her about how being isolated meant that you also really concentrated on yourself too much. She said, and it's bad, but it's true. And I think that that intensity of the experience and certainly the loss of services, the loss for people to have those outlets as well that were really so important in carers. And we heard that theme coming through so much during COVID.
Yeah.
And I guess what we can reflect on that, and I don't know how much this is going on, I'd like to hear about that, what we've learnt from it, and what was sort of some of the key things that we've learnt and can take away. Has there been any sort of reflections going on?
I can only speak anecdotally. I can't quote you any research about that. But anecdotally, I think more than ever the thing of connection came through. People were grasping at it, and what we may have taken for granted, all of us, as being readily available before, became a real, as important as oxygen. So we went online with our education services, and our Zoom numbers, even though we all don't like Zoom very much. Hello, can you hear me? You're on mute. went through the roof, you know, not the same as sitting in a room. I heard you say that before. Absolutely not. But people, I think that intensive experience helped them recognise their own need. I think, kind of related to that too, I think it's made peak bodies like MS a really important place for carers to come to understand their own needs, and maybe COVID has helped facilitate that. You talked about the intensifying experience of COVID. So, you know, for MS Limited, this is an opportunity then for you to recognise the importance of connection for those with the diagnosed illness and those others around them living with MS. And so if that's good that comes out of it, great.
Well, it certainly has here, and yeah, there is lots of good that can come out of it, and maybe that will really be the next year or so. And when I think about one of my favourite images that I use when I think about carers is just the simple safety sheet that you get on the plane. It's safety, and it's putting your oxygen mask on first, and it's such an easy thing to get into your head that you really, when you use the word oxygen, that brought that back to me to say, you know, make sure that so often you forget to put your own oxygen mask on for carers, and yeah, that's like you've pointed out so much, that really can leave people in a really vulnerable place.
Yeah.
So that's for sure, and I'm sure that image is well cited in your work as well. It
is indeed. So I guess if there's a key message today, it is that carers need self-care. When I ask carers, you know, in groups, why is it important that you look after yourself? Inevitably, 99.9% of the time they say, well, if I don't look after myself, no one's going to look after, you know, who's going to look after the person I support? Yes, that is true. But to sound like a dog at a bone, also the other reason for self-care is your life is of equal value to those who you are supporting. So the takeaway message for carers out there is self-care is not an indulgence. It's not selfish. Let's turn that S word from selfish to survival. It's part of you being able to live a full life despite this really devastating diagnosis that has now entered into your domain. So self-care, some sustenance, seeking your own sense of meaning are vital and can be achieved.
Great, and it sounds like with lots of resources available.
Yes.
That gateway sounds great. So I know the details are readily available from our MS Connect team, but it's certainly something I looked at as well too. And websites are always sometimes a safe place to open a door, aren't they? And to say, yeah, it's okay that I recognise this, and certainly I think that you know, take home message is great. And I would add to that there's lots of people who are carers, and it's okay to self-identify as that.
Yep.
Even if you're not really comfortable with the word, it's still okay to do that.
Yep.
So thank you so much for your time.
You're welcome.
And it was lovely to have you, and we will look forward to more work done by Carers Vic and the great work that you're doing.
Thanks very much, Jodie.
Thanks.
Thank you.